Remember when we talked about the heart in lecture, if I could have somebody do it zoomy for me. Or actually maybe let me, when we talked about the heart in lecture, the first thing we talked about was the fact that it sat in the it sat in the middle mediastinum, and it had a fibrous pericardium, or a pericardium completely surrounded it. The mediastinal pleura is going to be on the outside of that, and if we rotate that to the inside, that inner layer is going to be serous parietal pericardium. Parietal means wall. And it's going to come and turn on itself to lie on the surface of the heart, which makes it visceral serous pericardium or epicardium. So that's that little sleeping bag or the little pillowcase that goes all the way around the heart. If we open up the heart and think about, first of all, how many chambers do we have to the heart? 4. We have 2 atria and 2 ventricles. And if you looked at a heart from the outside, we would notice that the atria are located above what we call this area around here. That is the coronary groove. And there'll be atria located above that, and the ventricles will be located below it. Off of both of the atria, we have these little flap-like or elephant ear-looking appendages called auricles that are associated with the atria. So we have a coronary groove going around the outside. We also have interventricular grooves which go between the ventricles. If we hold the heart in our hand and look for this very wide and deep and angled groove, that is called the periconal interventricular groove. And from that groove, if I look at the heart that way, to the right of the periconal groove is the left ventricle, and to the left of the periconal groove is the right ventricle. When I flip the heart over, there's another groove, the subsinuosal interventricular groove. This one is a little less prominent than the periconal and tends to be, straight up and down. And to the right of that would be the right ventricle, and to the left of that would be the left ventricle. So if I was to show you this heart, I'm going to show you both sides, this side and this side. Tell me what groove is this? Periconal interventricular groove. It's angled and deep, left ventricle, right ventricle. Underneath, or on the other side, would be subsinuosal. What if I showed you this heart? Periconal, subsinuosal, straight up and down. Let me show you another heart. Here's one side. Focus. Help me. There it goes. And here's the other side. This would be periconal, and this would be subsinuosal. So if you look, whenever you're looking at a heart, if you think about that periconal interventricular groove first, to orient you to where the ventricles are, it will help you figure out what other great things are coming out of the top. So we talked about things that are coming into, or blood flow through the heart, and things that come into the right atrium. What comes into the right atrium? Our cranial and caudal vena cava they're going to drain this is a good one. Okay, here's a cast. So our cranial and caudal vena cava and our azygos vein, which drains the back region, is going to come into the right atrium. How many cranial vena cavas do we have? 1. These are not paired vessels. Of any of these great vessels that we talk about, it is only one of those. So you have a cranial vena cava and a caudal vena cava and a azygos. These are bringing venous blood into the right atrium. There is one other venous supply that needs to come into the right atrium, and that comes from where? The heart. Good. The heart itself, and that is called the coronary sinus. So if I'm looking in this heart, here's the periconal groove. No, here's periconal, subsinuosal. This is our right ventricle, our right atrium. I can see this little hole. Right here. And if I stick my probe in it, see how it goes around with that coronary vessels? That is the coronary sinus. And the coronary sinus does nothing more but bring in venous blood from the heart back into that right atrium. So 4 things enter the right atrium: cranial and caudal vena cava, azygos, and the coronary sinus. Interestingly, if you look at this coronary sinus, guess which groove is below it? Subsinuosal. Below the coronary sinus. So right underneath the coronary sinus would be our subsinuosal interventricular groove off of that right atrium. So let's talk about that cranial and caudal vena cava coming in to the atrium. For the most part, the atrium is smooth on the inside, but when we look out into the auricle region, we can see that it looks really meshy and fibrous meshwork inside there. And those are called pectinate muscles. The dark things, the dark areas that you see are clotted blood. Hello, focus. All right, so those are pectinate muscles on the inside of the auricles. People have often wondered what the purpose of an auricle is, whether or not it's just to hold a little bit of extra blood, because the atrium aren't that large themselves, and that is probably true. They will contract when the atria contract themselves. So we have this little smooth area. As our cranial and caudal vena cava are coming in here, and our caudal vena cava here, notice that there's this big ridge of tissue right here. That ridge of tissue is called the intervenous tubercle. Think of the name, enter between the two cranial and caudal vena cavas, tubercle, and it's a bump or a tuberosity kind of thing. Why do you think we'd want to have an intravenous tubercle right there? Essentially, you're going to have blood coming in from both the cranial and the caudal directions, trying to get into the right ventricle. If we didn't have this intravenous tubercle to divert that blood down, it would just go right past itself, or that have an opportunity to do so. So the whole purpose of having that intravenous tubercle is to divert blood from our cranial and caudal vena cava through the atrium and down into the right ventricle. As we look through the opening into our right ventricle, we'll notice these flap-like things, and those are, our right AV valves. And they're going to look the same on the left side, as we'll see in just a minute. And those right and left AV valves are going to be attached to the surface of the inside of the heart by these little strap-like things called chordae tendineae. And they're attaching to these lumps of tissue bulging from the inside of the ventricle, and those are called papillary muscles. So the chordae tendineae from our atrioventricular or AV valves on both the right and left sides will be attached with these chordae tendineae. What was the purpose of the chordae tendineae? Keeps the valves from everting back up into the atrium upon contraction of the ventricle. One of the other things I talked to you about in class was the idea or the feature that the inside of the ventricle wall was not smooth, but in fact had little pits in it, and we call that trabecula carneae. And as I can't remember who was it that looked it up, they serve the purpose of, if it was smooth, it would cause sort of a suction effect in the heart, which I think is kind of interesting. Didn't know that. So that is our right atrium through our right AV valve, through our right ventricle. Where does blood go next? Into the pulmonary trunk. So if I was to hold this heart here, and here's our periconal groove, here's our right ventricle, what is this large thing here? The pulmonary trunk. And as blood goes through that pulmonary trunk, it has to go through a valve, and that valve is called the pulmonic valve, and it is what we call a semilunar valve. Hold on one second. That was not the one. Oh, here it is. Okay, so here's periconal. We're in our right ventricle. We're coming out that pulmonary trunk, and see this little cute little parachute cusp here, and there would be another one, but we've cut the little hole there. Those would be our semilunar valve, or parts of our pulmonary valve. Notice that as that right ventricle narrows to go up into the pulmonary trunk, to then go to the pulmonary arteries, that region here is called the conus arteriosus. Conus, because it sort of cones up into this artery or trunk and becomes then the arteries. So if you looked at this heart here, focus. It's not listening. There it goes. Or not. There it goes. Here we're in the right ventricle, and it narrows up into that pulmonary trunk. So this region of that narrowing is called that conus arteriosus. Subsequently, then, this groove is called what? Periconal interventricular groove. What does para mean? Beside the conus arteriosus. Light bulbs should be going off in your head right now. Yes or no? Okay. So, from our right ventricle through our pulmonary valve into our pulmonary trunk, and then we're going to go 2 pulmonary arteries to the right and left lung. What are we going to do there? Get oxygen. We're going to come back into the left atrium. And the left atrium, I really don't have a good thing to show you for the left atrium. But the left atrium is going to look just like the right atrium in terms of the fact that, oh, here's one. Hold on. Focus. Thank you. In terms of, it has an auricle right here, and those pectinate muscles, or that meshy looking stuff on the inside. And it has also a AV valve that comes between the left atrium and the left ventricle. That AV valve is also going to have these little guys, the chordae tendineae, attaching to papillary muscles on the inside of the ventricular wall. From the left ventricle, where does blood go next? Out the aorta. And the aortic valve is going to look I don't think I have a good aortic valve. Our aorta, so I'm going to show you the pulmonary. Hello. It doesn't listen. So the aortic valve is going to look very similar to our pulmonic valve in that it is a semilunar valve or an outflow valve, which blood is then going to go out to the body. Remember, I talked to you about, first of all, let me do this one thing. So which one of our ventricles is going to have the thicker body wall or thicker muscular wall? Left. So if I put this on the test and said, tell me what ventricle? Left. Tell me which one? Right. And why is that? The right ventricle only has to pump blood to your lungs. They live right next door. The left ventricle has to go to the tip of your toes, which is a lot farther away. And just like a muscle bodybuilder, the more you have to lift or push, the bigger your muscle is going to be. We talked about a structure like this that attaches from the interventricular septum to the wall, and that is called the trabecula septomarginalis. And it is not a chordae tendineae. It is a completely different structure. It is not attached to any of the valves. All right? So trabecula septomarginalis, there would be one here. That would have been one right there, coming across here. Here's a big one. Hold on. Oop. See that big one right there? Big, thick, muscular fiber. And again, here in this right, it's a little dark in there, but those would be trabecula septomarginalis. So the question was, is that just in the right side? I always see them in the right side. Does that mean you can't have them in the left side? No. You could, but I have never not seen one in a right side. So always look for them on the right side. Very quickly, just to remind you, before we quit here, about fetal blood flow, your favorite. All right, remember that oxygenated blood is going to be coming into the right atrium, and somehow it needs to get to the aorta to go to the baby's body, right? So we have two ways of doing that. One way is to skip through from the right atrium to the left atrium through a structure called the foramen ovale. And that foramen ovale, after birth, should then shut the door, or that door will close, because now we have more pressure coming into the left atrium that pushes the door closed and it heals. If you look in this particular heart, this is our coronary sinus coming into our right atrium, and we can see sort of a little divot in here. That would have been where that foramen ovale would be. After it closes, it's called the fossa ovalis. It usually creates a little indention, fossa ovalis. The other way, when we had in fetal blood flow that we were trying to get from our right side to our aorta, was to go from the right ventricle and then out the pulmonary trunk. But then we had this opening through the pulmonary trunk into the aorta. So here's our pulmonary trunk, here's the aorta, and here is a connection between the two. And when that connection is open, that is the ductus arteriosus, present normally in fetal life, but after the animal is born, that should close. This now then becomes the ligamentum arteriosum. If it doesn't close, we call that a patent ductus arteriosus. So here you can see that connection. Oh, lost it on that one. And here is a really good example of that connection as well. Okay, does anybody have any questions? So those really encapsulate the internal terms and structures that you're going to be responsible for knowing about the heart. Today, if we could finish up the thorax and finish up all of your autonomics. You're welcome to come and look at any of these hearts. Just please keep my plastinated ones away from the wet ones. Any other questions? Comments? Good? Okay. Off you go. All right, so Group A needs to go to out of lab for radiology. Let me just tell you, the radiology site for the thorax for this section was a little scarce, and so we worked together to come up with a must-know terms list. So those will be the things that you're going to want to focus on for radiology of the thorax. So A goes for about an hour, then B will go, and then we're out of here. Okay? And